You've learned BLS for adults, but what if the victim had been a child?
Hey, Daniel, are you okay?
There are important differences between BLS for children and for adults. Under the American Heart Association BLS guidelines, anyone from the age of 1 to puberty is considered a child. For these BLS guidelines, puberty is defined as chest or underarm hair on males and any breast development on females. When performing compressions on a child, use 1 or 2 hands, whichever allows you to provide deep, effective compressions. Compress to a depth of at least 1/3 the depth of the chest, about 2 inches or 5 centimeters, allowing the chest to recoil completely. If you are unable to compress to the correct depth with 1 hand, either due to fatigue or lack of upper body strength, use 2 hands to provide ongoing high-quality compressions. For a single rescuer for victims of all ages, use a compression to ventilation ratio of 30 compressions to 2 breaths. If you are in a 2 rescuer team for children, the ratio should be 15 compressions to 2 breaths. Delivery of breaths to children requires less volume and force, but you still need to use enough air to see the chest rise. There are some differences in when to activate the emergency response system. If you did not witness the arrest and are alone, you should perform 5 cycles of CPR before you leave the child to activate the emergency response system. If the arrest is sudden and witnessed, leave the child, activate the emergency response system, get the AED or defibrillator, then return to the child. As you can see, there aren't a lot of differences between adult and child CPR, but they are important ones.